Let me introduce Dr. O'Connor from Community Care Pediatrics Latham, located at 6 Wellness Way off Route 9 in Latham. Dr. O'Connor is a board-certified pediatrician, a fellow of the American Academy of Pediatrics, and a Capital District Pediatric Society member. She received her medical degree from Michigan State University College of Human Medicine and completed her internship and residency at Georgetown. After training and working in the DC metro area for many years, she learned to be culturally sensitive and understand that everyone's unique background shapes and impacts their view of health and well-being. And Dr. O'Connor incorporates this view when working with her patients to achieve their healthcare goals together. She cares for her patients as she would her family and friends, which I know any parent or guardian would appreciate. Beyond being an excellent doctor, Dr. O'Connor has some pretty interesting interests as well, including playing the ukulele, speaking Tagalog conversationally, and reading and exploring restaurants. So thank you, Dr. O'Connor, for educating all of us today. I will now turn it over to you.
Great. Thank you very much, Alexis. And thank you for all of you for being here this evening. So as Alexis mentioned, I'm one of the providers at Latham Pediatrics. And today my talk is called Call the Pediatrician, Common Newborn Concerns, When to Worry and When Not to. So tonight I'm going to go over some of these common newborn concerns that you might encounter the first few weeks with your baby. And my hope is to equip you tonight with some knowledge so that you know when you can play it cool and when you should give us a call for help. Next. Here is kind of my agenda for the evening here today. So we're going to go through some newborn rashes, baby noises, their umbilical cord, and spit ups, stools, their eyes, their head, and a little bit about fever. And of course, at the end, we'll have some time for questions. So again, if you've joined us for our previous 3 talks, you probably have know all of this information by now, but for our new participants today, this is our information about our office. We're called Community Care Pediatrics in Latham, also known as Latham Peds or Latham Pediatrics. We are at this brand new medical facility building, so beautiful, that just opened last year. Our particular office is open 5 days a week from Monday to Friday from 8 a.m. to 4:30. But we also offer Saturday morning hours for those kiddos who are sick and newborn babies who are following up from the hospital. We're an all-mom team. We have 6 physicians and 3 pediatric nurse practitioners. And our office has 24/7 availability for any emergency needs. Our office, like I said, is located in this brand new medical facility on Wellness Way off of Route 7, Route 9, and I-87, super convenient to get to. And it's really, truly a one-stop shop. You have the pediatrics office there. There's also an internal medicine office. There's a OB-GYN office. There's all other specialties, including a lab, imaging, the pharmacy, and even a little cafe there. So come and see us. Next, please. So here is kind of the start of my my talk here. So newborn rashes. So there's so many common newborn rashes that appear the first few days, first few weeks of life. And I will tell you, a lot of these look scary and sometimes they look pretty gross, but they're not very worrisome. And a lot of them pretty much resolve on their own. So I wanted to highlight a few of the very common ones that are always brought up in the office. So the first one there, the top left picture is what we call erythema toxicum. And this actually appears pretty quickly, the first like 1 to 3 days of life. They appear as small, multiple little red spots, some with little pustules on a very red base. And it can appear anywhere in their body, but a lot of times it appears kind of on the trunk, like the back, the chest, the abdomen, and sometimes on the arms and legs. I like to say they look kind of like little flea bites or bug bites, and they don't usually hurt or itch or anything, and they resolve within a week, and really without us doing anything about it. The next one is transient neonatal pustular melanosis, and that's the top right picture there for you. Now, this type of rash is more common in our darkly pigmented babies, but really can occur in all skin types and pigmentation. This one appears kind of like small little pustules with some surrounding scale. Again, doesn't bother the babies at all. It doesn't hurt, doesn't itch. This one can last a little bit longer, but usually will resolve after a few weeks. Now, the bottom left corner picture there is milia. Now, this is another common transient rash that's actually due to blockage of sweat ducts. Now, this is kind of like what we call a heat rash or prickly heat. And again, goes away without us really doing anything except for kind of placing our baby in like a cooler environment, or even changing them into an outfit that's a little bit more light and airy. And the very last picture here on the bottom right, that is neonatal cephalic pustulosis. Again, super common rash. And this one is actually mistaken a lot for neonatal acne or infantile acne. And it's usually limited just to their face, and sometimes on the scalp as well, and sometimes on their neck area. This will resolve on its own, again, in a matter of weeks. Sometimes if it's really if there's a lot of it and it's more severe, we can treat it with just some over-the-counter topical hydrocortisone cream, or even an antifungal cream called ketoconazole, just to help expedite the process of it resolving on its own. Now, in all of these cases, the baby is totally well appearing. They're feeding well, they're going to the bathroom well, there's no fever, they're acting totally normally. So the rash is just there. And so really treatment of all of these is really nothing. All of these resolve on its own without us doing any intervention at all. Now, many parents ask me if they should put lotion on their baby's skin or anything to soften up their baby's skin. And I always really say less is more with newborn baby skin. Many of these rashes will resolve on its own, and it's really just best to avoid using any topical products that may trigger irritation on the baby's skin. Next, please. Now, this is another common thing we'll see within the first really few hours of their life, is like skin peeling. So it looks like the baby's skin is peeling, and it kind of is. So the baby has been in utero, bathed in amniotic fluid for 9 months, and now they're out. So all of that top layer of the skin just needs to slough off. And again, you don't have to put anything on it. You can just leave it be. Eventually, over the course of the next couple of weeks, all of that extra skin will sort of slough off, and it'll just be their nice little soft baby skin. Next. Now, this is another common thing we find called a nevus simplex. Now, the babies are born with this. They come out with these red marks on their skin. Up to 40% of newborns will have this at birth. We sometimes call them salmon patches or stork bites, particularly the one on the back of the neck there we call stork bites. Now, these are large capillary beds that are very, very close to the surface of the skin. They appear as flat red patches that are non-blanching when you press on them. They can occur at any part of the body, but mostly on the head and the neck. Again, common for it to appear, these ones are common for it to appear even more red, like more red when the blood flow, when there's more blood flow to that area, such as when the baby is crying or if they're upset or if they're straining or even when they're in a warm bath. Next, please. So when should you call us? Okay, all these rashes, I've just been saying, these are all normal. It'll go away on its own. Now, when do you call the pediatrician? So rashes that we actually don't like, rashes that we worry about are those ones that are like blister-like or fluid-filled. Those that have discharge from them. We'll kind of think twice. Some of the rashes that I mentioned can be widespread, but we'll kind of think twice if the rash is widespread. So let us know if that's the case. And again, call us if if your baby's not acting right. Like I said earlier, in all of those normal newborn rashes, the rash is just there, but the babies are totally just acting like their normal selves. So let us know if your baby is not acting right while they have the rash. They're not feeding very well, they're inconsolable, they're irritable, they're lethargic, like they're truly difficult to rouse, and also if they have a fever. Next, please. Now, the babies are very noisy, okay? Just like when you move into a new house or a new apartment, your senses are all heightened to all of the new noises that you hear in your new home. So after you bring home your baby, it'll be just the same. You're going to notice all the little grunts, all the little squeaks that they make. So there's a lot of snorting, there's a lot of grunting, there's a lot of hiccuping, sneezing, and something special called the periodic breathing pattern of the newborn. So in all of these situations, if your baby seems like they're pretty calm, they're pretty comfortable, or even if they're sleeping and making these sounds, then don't worry about those. Now, I wanted to highlight the periodic breathing pattern of the newborn because this is one of the most common things that parents bring up to me in the office. So the periodic breathing pattern of the newborn is when the baby alternates between rapid, shallow breaths and then slower, longer breaths. And this can persist for several seconds and actually usually happens when the baby is fast asleep. And so this is actually a sign of the baby's immature and developing neurologic system and is totally normal. And babies outgrow this around 6 months of age. Next. Now, call your pediatrician if your baby is truly having labored breathing. Now, signs of respiratory distress in infants and toddlers are the following: persistent rapid breathing, retractions, and nasal flaring. So retractions are something that you can see on your baby's chest or even on their neck. So it'd be good to, if you're truly concerned about whether they're having labored breathing, you should expose their chest and kind of remove all of their clothing so you can see how hard they are breathing. And retractions is you see kind of an indentation on the side of their ribs. You can kind of see their ribs going as they're breathing because they're using all of their muscles to kind of bring in air and out through their lungs. So those are the signs of respiratory distress in infants and toddlers. So call us for those. Also call us if you're seeing color change. What we're really concerned about is cyanosis or blue, the color blue, usually kind of in the central part of their body, like around their mouths even. Oftentimes parents will say, oh, they turned so purple or red because they were crying or holding their breath. And that is, yes, concerning at the moment, but not truly worrisome. Call us also if your baby has apnea. Now, this is a true pause in breathing for over 10 seconds. Call us if they're limp, they're not responding normally, and of course, if they have a fever. Now the belly button, so the umbilical cord, right? So the umbilical cord is going to dry and over several days. And then sometime between 1 to 3 weeks of life, the dried belly button cord will separate from your infant's body. And during that process, it's normal for it to have some mild, sort of clear yellowish discharge or even bloody discharge. Parents will often notice some dried blood or discharge on the waistbands of their diaper or even on the inside of their onesie. And again, this is normal. Now, when the dried stump finally falls off, it often will still appear somewhat moist on the inside. Um, and I usually tell parents to kind of give it another 2 or 3 days to dry completely before attempting a submersion bath. Next. Now, with regards to the belly button, call your pediatrician if that discharge is copious, if it's thick or pus-like or has a foul smell, if there is a deep redness on the skin around the belly button, if there's discomfort or tenderness to the touch, and again, if your baby's not acting right, they've got a fever, they're lethargic, they're irritable. Now, these are all signs of pretty rare infection called omphalitis, or the infection of that belly button. Next. Now, spit up. This is probably one of the most common things we talk about with our families with newborns. And I will tell you, I have never met a baby who did not have some level of reflux. And it's normal for babies to spit up once a day, or even 6 or 10 times a day, or after every feed, or even like an hour or two after their feed. The spit ups can be clear, it can be white, it can be curdled, it can even be a little bit yellow. And so there's a lot of times when we're helping families differentiate whether the spitting up is physiologic or pathologic. So there's actually several anatomic reasons why newborns are more prone to spitting up compared to like older children or even like toddlers. But as their body grows and develops, the spit ups improve. And oftentimes, I will tell you, the spit up will probably worsen before it starts to get better. But usually, parents notice an improvement around 4 to 6 months of age. Now, when we differentiate between physiologic reflux and pathologic reflux, so in physiologic reflux, we're looking at babies who we call them happy spitters. The milk or the clear fluid will kind of just spill out of their mouths. It can be any amount. There's no blood in it. There's no bile in it. The spit up is not projectile, like I said, it sort of just spills out of their mouth. And the babies are always just kind of like happy and just doing their thing. They're happy to eat, they're gaining weight well, they're going to the bathroom well, and all of those other things are normal. Now, the opposite in pathologic reflux. So these babies are really they're very fussy. They cry out in pain. It can lead then to some feeding aversions. And of course, ultimately kind of lead to poor, slow weight gain. So for the most part, I will tell you that most spit up is physiologic. But again, we often will help families kind of determine and figure out whether it is physiologic or pathologic. So the most common things we advise for families to do at home to help their babies is what we call reflux precautions. We ask them to pace their baby's feeds, right? So just like adults too, the faster we eat, the more we tend to consume. And same thing with our babies. So if they're kind of glugging down that milk really quickly, they tend to kind of overeat a little bit more. So we recommend for families, parents, or other caregivers to try and pace their feeds, have them take breaks with, if you're bottle feeding, have them take breaks with, every ounce or so, get them up, kind of give them a break, burp them, or if you're nursing your baby, then taking breaks in between breaths. frequent burping, and then we also recommend to keep the baby kind of upright or inclined for a good 15-20 minutes after feeds. Next. So again, call your pediatrician if that spit up has blood in it, has bile in it. So bile is like truly like neon yellow or green. If it's projectile, if it's forceful, it's like shooting out and it's persistent. Like every time they have a spit up, it's projectile. And then also call us if baby appears like they're in pain. They're crying, they're arching their back, they're stiffening their legs, they're sort of refusing those bottles because they know it hurts, and they're feeding poorly. Next. All right, number 2, so baby poop. So within the first 24 hours of your baby's life, they're going to expel their first stool. This is going to be that black, sticky, tarry poop that we call meconium. And as the baby starts to eat, all of the meconium starts to get passed through, and the baby's stool starts to transition. Now, most newborns will eventually have soft yellow or green, and sometimes seedy stools within 3 to 7 days of life. And depending on what your baby is eating, whether it's breast milk or formula, a combination of both, their stools may change over time. As soon as they are born, their gastrointestinal tract is changing and it's maturing, and it's populating all of those normal good bacteria that's supposed to be there in the gut that helps it in its functions. And it's changing daily. So even if they're eating the same things every day, their stool might still change in color, consistency, and frequency. Now, there's no, oh, I'm sorry. This is especially true of infants who are also drinking breast milk, because breast milk is a very dynamic food source, and it changes, its composition changes to meet the baby's needs as they grow and change. So this is often reflected in the infant's stool changing also. Now, a word about frequency. Just like spit up, there's such a wide variety of what is normal in infant baby pooping frequency. Now, it can be normal for them to poop once a day or 5 times a day or once every 5 days. And really, as long as they are feeding well, their tummies are nice and soft, and the poop, when it does come out, it's nice and soft too, then the frequency doesn't matter. Next. Now, these are the reasons to call your pediatrician if there's blood in it, if there's mucus in it, like it looks like stringy, snotty material in the stool, if it's black or chalk white. So any color of stool is fine in terms of like whether it's yellow, green, orange, brown, any shade of those colors, those are all fine. The only colors that are alarming to us are red, like blood, of course, black, like that meconium poop. Once that's all gone and the baby's poop has transitioned, it shouldn't go back to that. And then chalk white, like truly white poop. Next. So eyes, common concerns and common complaints about the eyes. So nasolacrimal duct obstruction. So we all have a nasolacrimal duct kind of here in the middle part of our eyes towards our nose. And those ducts, basically their job is to drain the tears and oils that our eyes produce. And in newborn infants, those ducts are teeny tiny. So they're very, very prone to getting obstructed or clogged. And when they're clogged, then they can't drain all of those things that it's supposed to drain. And then ultimately it sort of turns into like crusting on the eyelashes, or even some like very scant amounts of mucoid material on their eyes. And so oftentimes parents get concerned that their baby has pink eye and they're worried that it might be an infection. So that is a very common one that we talk about in the office. Another one that we talk about in the office a lot is the lazy eye. So our eyeballs are controlled by its movements are controlled by 6 different small muscles around the eyes. And when the baby is first born, those muscles are all trying to kind of strengthen up and work together so that the two eyes kind of move together in synchrony. And so sometimes in that process of strengthening, one of the muscles might be like kind of a little bit weak, and you'll notice that the baby's eye will kind of turn inward periodically and it'll go back, or it'll turn outward and then it'll go back. So that again is totally normal. As long as it comes back to midline, it's normal for your baby to be cross-eyed periodically, intermittently the first few weeks of their life. Now, with regards to the eyes, the reasons to call us for are signs of true infection, right? So if the whites of the eyes are red, if the eyelids around it are also red or swollen, if the baby's sick, like if they've got some sort of upper respiratory infection, or again, if they have a fever. And then in terms of the eye aligning, again, like I said, it's normal for it to cross or kind of turn outwards, but as long as it's intermittent and it comes back to midline. So please call us or let your pediatrician know if it's that one eye is just always turned in and it's not going back to midline, or it's always turned out and it's not going back to midline. Next. All right, so this is a schematic of the infant's skull. So the little diamond is the anterior fontanelle there, that soft spot. And this might pulsate from time to time, especially when the baby is feeding or sucking on a passy. So don't get concerned about that. A lot of people get concerned about that. So that's totally normal. So your baby's head, when the baby first emerges from the birth canal, their head shaped might be a little bit odd at first, just because it's coming out from the birth canal and there's a lot of pressure on that infant skull. But don't worry about that. The infant skull is not set in stone yet when they're first born. The baby skull is made up of several soft, flexible bones, and they are connected by fibrous tissues that we call sutures. And this makes it so that it allows for growth and shape changes during the baby's infancy phases. So where the suture lines are, sometimes you can feel that on their scalp and it feels like ridges. And again, that's totally normal. And it's almost, I tell parents, it's kind of like tectonic plates. Sometimes they kind of override each other. And sometimes you'll feel those ridging. And again, that's normal. Next. In terms of your baby's head, I would say one thing to call us about is if you observe that your baby's head is always kind of turned to one side, sometimes this might be an indication that they might have torticollis or a strain basically of their muscle on the neck, and it's tight on that one side. Oftentimes this is due to positioning in utero. And a lot of times parents will tell me, oh, like I try to turn their head to the other side, but they always go back to that side. So let us know if that's the case, if you're noticing that they have a preference and if you're trying to entice them to turn the other way and they just kind of always go back. Oftentimes that'll also lead to flattening of the head on that side. And usually this is pretty easily remedied by stretching exercises that we usually usually will teach to our parents in the office, and parents can do the exercise stretching exercises with their babies during their diaper changes at home. Next. And then I did mention fever a few times, right? So fever is one of those warning signs too, that you should take to call us. Now, fever in newborns, especially those under 2 months of age, is a true medical emergency. So anytime your baby has a fever, especially if they're a newborn, call us ASAP. And as I mentioned, our office, we've got 24/7 coverage. So no matter what time of day or night, if your baby's got a fever, please call. And what we call a fever is 100.4 degrees Fahrenheit or higher. And in newborns, it's very important to get the temperature very accurately. So we very much recommend using a rectal thermometer to get that temperature. And I tell parents, please make sure they weren't like over bundled or in a warm spot of your home when you're taking this temperature. Make sure that all of those environmental factors are not playing into the fever. And then again, if they have 100.4 or higher, you should be calling the pediatrician ASAP. I think that is the end of my talk. I think if we have any questions, I would take them right now.
Yeah, we have a bunch of questions, which is great.
Awesome.
Let me start from the most recent and work my way down, and we'll catch all of them.
Cool.
How much tummy time is recommended for newborns to help with head shape?
Yes. So I always tell people that there's no too much tummy time. So you can really start right from the get-go. And there's different ways to do tummy time. So some parents will do it kind of reclined on their chest while the baby is on their chest. Some will do it kind of propped up like on a boppy or on the floor or playmat, and then some people will just do it straight on the playmat. So I really there's no too much for that. I usually tell people to, whenever their baby has a wakeful moment, when they're awake and they're alert, just put them on their bellies for tummy time. At the beginning, they're sort of not really going to like it because their heads are pretty heavy, and they're probably only going to last maybe a few seconds, maybe up to a minute the first few weeks of their life. But as they get older and they get stronger, they definitely last a lot longer.
Okay, great. The next question is, how do I know if my baby is constipated or if infrequent stools are still okay?
Yes, so that's what, yes, so like I said, the stooling frequency, it could be a wide variety. So what we worry about in terms of constipation is if the baby is uncomfortable. If you can tell that they're like grunting and trying to get a poop out and they can't get it out, or and then like when it does come out, it's sort of like more firm or more solid, then that's what I would consider constipation.
Okay. What's the difference between spit up and vomiting in newborns?
Yeah, I would say um s- uh spit up is more just like a effortless, um it's sort of more effortless, like the milk just sort of like spills out of their mouth. Now, when I imagine someone vomiting or like having more projectile, it's more force to it. Like their body is like trying to expel the contents of of their stomach. So a lot of times with normal physiologic spit up, um, it literally just like kind of spills out of their mouth. There's no force to it.
Okay. Regarding concerns of breathing and sounds, fever, should you always call the pediatrician first, or when do you just go straight to the ER because it's a true emergency?
Yeah, I think it's with the if your baby looks like they're truly in distress, like I was mentioning, they're having that persistent rapid breathing, they're retracting, they're grunting, and they look like they're having a hard time. I think that it's not unreasonable to just go to the emergency room. However, if you are hearing these noises or these grunting and all of these things, and you're looking at your baby and you're like, yeah, I mean, they're making all these sounds, but they don't look like they're labored. Um, and you're not quite sure, it's never a bad idea to just call the pediatrician.
Okay, let's shift to detergents. Can
Mhm.
newborn skin sensitivity be linked to detergents, soaps, or lotions?
Yeah, certainly their skin is very sensitive in general. So yes, just like anybody's skin, we can their skin can also be susceptible to contact or irritant dermatitis. And so oftentimes we are recommending to use bath products or laundry products that are unscented. And so a lot of times, the extra sort of chemicals that the companies will include in those products to make them smell good, they can potentially be irritants for sure. So we are usually recommending just plain and simple unscented products for the babies.
Here's one. What are the most common reasons parents call the pediatrician in the first month?
The most common ones, I will say, rashes. I would say rashes and spitting up. I think those are the two definitely most common ones. Thank you very much. Thank you so much for joining me this evening. Um, Babies are one of my favorite, genres, I guess, of pediatrics. And so, um, good luck to all of you having or expecting new infants here. I hope you learned something today, and I hope you um, find confidence in your ability to take care of your baby.